So good morning, everyone, and welcome to the 2024 NAMI New Hampshire Annual Conference, Cultivating Hope, Celebrating Our Everyday Heroes. Thank you for joining us. Thank you for those that came back from last night's keynote session with Dr. Javier Amador. The recording for that and all of our sessions will be available here in the lobby later this week, as well as on the NAMI New Hampshire YouTube channel. If you're new to NAMI New Hampshire, we are so glad that you are here. If you're a longtime member of the NAMI New Hampshire family, thank you for coming back. NAMI New Hampshire is a grassroots organization that provides support, education, and advocacy to individuals and their families impacted by mental illness and suicide in the Granite State. We do this by offering a variety of programs and events, including today's conference. I'm Michelle Watson. I'll be one of your co-hosts for today, along with my coworker, Karen Privé. We have an amazing committee of staff and volunteers whom we wanted to recognize for all their valuable contributions to the conference. In addition to our planning committee, we have to thank our development team, our communications folks, and our technology folks. We really couldn't do this without everybody. Today's presentations are in Zoom webinar. There is not an option to turn on your camera or your microphones. We welcome questions in the Q&A and we'll do our best to get to all of them. You may have also noticed that we've turned off the chat feature because it can often be distracting. We'd like to express our sincerest gratitude to our sponsors who help make today's conference free of charge. Our Hope sponsor is Johnson & Johnson, and you will hear a few words from Ward Bennett, Healthcare Policy and Advocacy Director, later in this session. So now I have the privilege of introducing NAMI New Hampshire's Executive Director, Susan Stearns, who will get started this morning. Susan.
Thank you, Michelle, and welcome everyone. We are truly pleased to be able to kick off today's full day of conference sessions with a conversation with Commissioner Lori Weaver. And just a little bit of, as I thought about how things have changed in the past year. Last year when I introduced her, she was the interim commissioner. So this year, we are really pleased to welcome the commissioner, Lori Weaver. She is the commissioner of the New Hampshire Department of Health and Human Services. With more than 25 years of experience with DHHS and a strong focus on working collaboratively across all levels and functions, other state agencies, and external partners, Commissioner Weaver has demonstrated leadership and success in achieving shared organizational goals and objectives. Prior to assuming the commissioner role, she served as deputy commissioner for 3 years, overseeing several policy areas and all DHHS operations. Previously, she held the position of Associate Commissioner of Operations, overseeing all operational aspects of the state's largest department. During her tenure with DHHS, Commissioner Weaver has also served as the Director of Organizational Development Services and the Director of Training Services. She initially joined DHHS as the Training Administrator for the DHHS Division of Children, Youth, and Families, a role she filled for 10 years. Prior to joining DHHS, Commissioner Weaver worked for several nonprofit agencies and served as the Director of Residential Services for Children and Youth in both New Hampshire and Massachusetts. Commissioner Weaver received a bachelor's degree in psychology from the University of New Hampshire and a master's degree in Human Service Administration from Antioch. She has received a certificate in organizational development from Antioch and achieved 64 credits towards a master's of counseling. Good morning and welcome, Commissioner Weaver. It's a real pleasure to have you here.
Good morning and thank you. Thank you for inviting me back again for this year. I'm very happy to be asked to be back and to be with you here today. It is true, a year ago I was interim commissioner. I think for a total of, it's been 15 months now that I've been in a commissioner capacity, whether it's been interim or full term. I think that the interim doesn't really matter. You're still doing the job and there's a lot of work to be done. So glad to have a term and a vision moving forward. As Susan mentioned, I'm the commissioner of a department whose primary focus is helping others. And I've been with the department since 2002 in all of those different roles. And prior to that, But pretty much all that to say that my entire career has been dedicated to helping others, whether it's in a direct care capacity, clinical capacity, or as in now in a leadership capacity. And I consider that a privilege and an honor to be in this role. As difficult and challenging as the role is, I take it very seriously, and I'm honored to be in the role. 15 months ago, we were knee deep with planning and implementing improvements for the mental health system, which is what Susan really asked me to focus on with you this morning. And you know, assessing the current state of New Hampshire's mental health system is really a matter of perspective. The 10-year plan launched a period in which the state delivered unprecedented resources to expand the availability and types of mental health services that our residents need. So when we think about from a bigger perspective, it's easy to see from a larger perspective that the system is in a better place than it was years ago. And I am really proud of what we've accomplished in the last several years. However, I can't stand before you today and say that we're completely satisfied or that I'm completely satisfied. You know, because those of you on the ground, on the front lines and living rooms and emergency rooms across the state, it's clear that there's work still to be done to build a system that helps people in the moment that they need it, the moment that they need it. And we know that needs are only increasing nationally. The demand for mental health services on the rise. As a department, we must continue to act with the urgency to build a system that can anticipate tomorrow's challenges while addressing today's needs. So I am going to give a little bit of an overview of the state of the mental health system in terms of some accomplishments that we've had. And I'm going to share a slideshow in a minute. But I just wanted to say that without your help, we wouldn't be able to make the changes that we've made. We're halfway through the state's mental health plan, the 10-year plan, and our progress and implementation provides a pretty good lens of where our system is at. For those of you that may not be familiar with the plan or have seen it or want to look at the plan, it is on our website under the hot topics under DHHS. I think you can also Google New Hampshire's 10-year mental health plan too, and you will find it. While New Hampshire's not immune to national trends, we've been able to make some significant gains in each of the core goals outlined in our plan. We are well ahead of the national curve with our Rapid Response Access Point, which was launched in 2022. Many of you know Rapid Response is a statewide integrated crisis system, 24/7, 365, supporting children, youth, adults, and families in emotional distress. In less than 2 years, we have about 100 skilled, compassionate and skilled workers for our rapid response. And those 100 workers over the last 2 years have provided hope more than 40,000 times to New Hampshire residents. So it's one example of how the 10-year mental health plan has made access to behavioral health easier for residents. So I just want to take a moment to share, rather than word dump on you all of the pieces here. I'm going to share with you. I think I'm going to share with you some of that work. So Susan, do you see the slide itself?
I do now.
Okay, so just the slide.
Yes.
So I wanted to, just moving along to the next slide a little bit, is to highlight we have 2 slides highlighting some of the accomplishments. So first one is what is commonly known as our TREC program. Some people might hear that acronym. It's the Transitional Residential Enhanced Care Coordination. That is a program really looking at a lot of our folks coming out of psychiatric care, out of residential care, and then trying to assimilate back into the community. We've got currently 172 youths as of the end of last year enrolled in that program. We've launched our Critical Time Intervention Program, CTI, for adults transitioning into the community, with more than 100 people graduated in the very first year. And so we've taken that program, stood it up, and now it's in operational mode, and we're looking to get that number up from 100 from where we were last year. We've developed a certification program for peers and crisis workers. We have a cohort of 24 that's about to receive their first certification. Last summer, we launched the Strongest Granite Public Awareness Campaign in partnership with NAMI and with many of you, I'm sure, that are joining us today. We also launched, which some of you may not know this, but it has been launched. We have a Children's Behavioral Health Resource Center website. So we're just going to take a moment here to plug that. we have resources, we have systems. Sometimes they're really hard to navigate. So we worked with UNH to say, hey, can you help make this easier for the folks and the families that are going to be going in and finding out where are the resources and how do they navigate that system? So that website is, you will also find that link to that website on our website in our behavioral health section. And that's relatively new. We have a juvenile justice transformation. In the first, we launched this a couple of years ago, but a couple of years out, we're looking at about a 50% decrease in how many of our kids are court involved at this point. So that's very significant, where we are streamlining and creating an assessment that's really strength and needs-based for some of these youth and diverting them from getting into the court system and instead being able to stay out of the system and still get services and supports. Our Fast Forward program, which is like our wraparound program with youth, we had families in 2019, about 100 families when we launched it. We're up to 520 families in 2023. That's pretty significant. The good and the bad is that, you know, trying to keep up with the pace of that and providing the resources, but very pleased at 520 youth. Within that Fast Forward program, we also have peer support services, and that's right now we have 60 youth involved that are providing peer support for many other youth. We have 20 specialty residential beds that we have stood up for complex physical and behavioral health needs. Last year, I talked about Solution Health with you. And at that point, we probably didn't have as much information as we have now, but suffice it to say, we know that we're going to be bringing in about 120 beds, but we're also going to be offering specialty services that we don't currently have in state, things like eating disorders, partial hospitalization programs. Solution Health is targeted to break ground this summer and start building, and I think opening in the beginning of 2026. And of course, there wouldn't be, you have to mention the investment in Medicaid reimbursement rates. That was pretty historical, getting that increase and its impact on our providers. I couldn't talk about the mental health system really without talking about Mission Zero. And I don't know, I think most people know what Mission Zero is, but I know there are folks that don't know what that is. Last year, we launched Mission Zero, which is our department's commitment to say zero. Our mission is 0 people on the wait list for services. And that's what we have put boots to the ground on over the last 10 months. And so Susan has been, and her team has been instrumental in working with the department. The New Hampshire Hospital Association has been instrumental in working with us. And I'll tell you that we work at multiple layers. So there's a leadership steering committee layer, but there's also boots on the ground. So collaboratively, you know, we as the department, we're responsible for the DRF system, the designated receiving facility system. So in managing that. So one of the ways that we said, if we're going to achieve Mission Zero, we have to be working together to bust down these barriers, these systems barriers. And believe me, there's quite a few of them. And we can't do it alone. It can't just be the state. So I'm really proud to say that 10 months later, we've actually moved the needle on Mission Zero. I want to share a little bit more detail on that, but Mission Zero breaks down into this next slide here. And I think I might have shared this as a handout. We basically looked at last year, what are 6 strategic initiatives that we could take that would have some immediate impact, immediate being anywhere from 6 months to let's just say 18 months on impacting that wait list. So you have 6 things here that are on this slide, but really I want to bring your attention to start with is number 3, which is our care traffic control. That is basically, it sounds like a funny term, but it's actually a term where we are working together to navigate and look at what is the need and what is the level of resource currently available, not just New Hampshire Hospital, but with all of our hospitals that have DRF beds, all of our other providers that may have them. How do we collectively say, okay, every single day, this is who we have for need, this is what we have for resources, and how do we create that movement? So we have emergency room physicians, nurses engaging daily. They have daily huddles with New Hampshire Hospital and looking at that. And I will tell you, as of yesterday afternoon, our queue was 7 for folks sitting in emergency departments. So if you've been paying attention to those numbers, you'll know that that's pretty significant drop from where we were like even a month ago. And so we launched care traffic control in January, and we did a soft launch in January. So there was a lot of work happening before that. So it's not to say that we weren't doing, but officially launched it in January. And I think we're starting to see some of the impacts of that. The children's wait list was down to 7 yesterday, and it was up as high as 13, 14 last week. So we're seeing a little bit of that impact, and more to come on that, but we're very excited about that. But what are other things that would potentially help get us to zero is if we look at number 1 and number 2, expansion of the certified community behavioral health clinics, really looking at primary integrated care right out from the start, so that we're not going right into crisis, but we're looking at prevention, we're looking at intervention. The crisis bed stabilization, the community crisis stabilization is really diverting from the emergency level of care. Can we provide some community crisis stabilization care that is before they're getting to the ED? We have 2 pilots that are going to be standing up this summer. We've been working with our community partners of community mental health centers to get those stood up, and we're very excited about that coming on board. So if you think about, again, that could potentially have an impact on it. I mentioned number 4, which is the expansion in the DRF beds. We have Dartmouth is actually adding 5 additional beds this September, I believe, will be coming online. So we will be expanding that capacity. But I will also share with you that we did announce yesterday, the department did announce that we are bringing 12 beds back online at New Hampshire Hospital from our E unit. So all of the units have a letter name to them. We have EF unit. We're opening up E unit with 12 beds as of April 1st. No joke, all serious, 12 beds coming online. With an additional 6 beds coming online by May 17th. So we'll be looking at increasing DRF beds by 18 beds on May 17th. And then we're going to bring the remaining beds, which I think are around 15 to 18 additional beds throughout this calendar year for New Hampshire Hospital, bringing it to full capacity. And then also we'll have the Dartmouth beds coming online. So I think when we think about, are we making a difference with diversion from to the ED? I think we're seeing a little bit of that, but now we're also building capacity should we need it to have those resources available. But we also have 5 and 6, which is really about, being able to come out of that high level acuity care and stepping down into least restrictive settings and less level of care, working on setting up those resources. We do have some facilities that are going to be opening up to be able to have folks step down into that level of care. We have some here with NFI stepping up with our PATH program here on campus and taking additional folks, as well as NFI is opening some programs up in Newport, some homes and houses as well. So that will relieve a little bit of space for folks to step down to. And our landlord incentives is really working with our population in terms of folks that are having challenges that, you finally get housing. We don't want it to be at risk, to be at loss. So really working with individuals and with the landlords to be able to work through the challenging times as they arise, so that losing housing doesn't become another added stressor. So that is our Mission Zero summary. When we look at the overlay of our mental health 10-year mental health plan, we think about the alignment. The big blue bubbles and circles are really the basic tenets of the 10-year plan. And then we have within that, nestled in there, our 6 initiatives that are aligned with that. So what's going to happen next? There's still a lot of work to be done when we look ahead in 24. I mentioned we have the behavioral health clinics coming online in 24. We know that we need more than the pilots that we're standing up. We have to really work with our providers in the community to make sure that they continue to have the ability and the capacity to stand those clinics up. Looking at our rapid response and creating some location-based rapid response in addition to the mobile crisis that we offer. Housing and the residential treatment options that I've mentioned, and really coordinating care to make sure people get the right care, right level of care at the right time, and that people aren't lingering in a spot where they don't necessarily, it's not the most appropriate level of treatment. And obviously working with our staff and really building some pipelines and getting some workforce training, but also in terms of creating some additional workforce. So there's a lot of stuff going on. I think Susan would agree. We spend a lot of time together every given week working on these things, and there'll be more to come. But I wanted to be able to provide a level of, we are making progress. I do want to share. I think I'm going to stop sharing just for a moment here. And I know we are going to take questions. But just to wrap up, I know this is a lot that I've shared in a short period of time. And I would say to you, it's okay if you don't remember all of it. However, if you do remember anything from what I've shared, please let it be that we're working hard to make the changes, to really improve our system, to bust down those system barriers, make a difference, and to meet the mental health needs as they arise in our state. And that we can't do it without all of you here. We really envision a system that anticipates at people's needs and works in harmony to provide those needs, because that's what you all deserve here in New Hampshire. So thank you for allowing me to come back and join you, and I hope you enjoy the conference. It sounds like it's going to be great.
Thank you, Commissioner. And I do want to say that I do believe we are in the midst of systems transformation, and we are really grateful for your leadership in this process and grateful for how you have included the voice of people with lived experience and helped to inform this work going forward. As you know, all of us here at NAMI New Hampshire do this work because it's chosen us, because how the issues of mental illness, suicide, or co-occurring substance use disorder have touched our lives personally. So truly grateful for you being here today. I think we do have a question in the chat, Michelle.
We do. Sorry, I was putting a comment in for people to start putting in some questions in the Q&A. The question we have right now is, how can we make sure that the community mental health center clients keep their Medicaid benefits? Many lost them after the COVID expansion ended.
Yeah, so that's a great question, and it's something that the department has been working with all of Unwind and making sure that folks have the appropriate insurance coverage, whether it's Medicaid or something else, other coverage. So we are actively working with not only those that are receiving services, but with our community mental health centers as well, to look at what are ways that we can make sure that folks get covered, whether it's Medicaid and or another insurance, because we don't want people to not be without services, and we also don't want to put unfairly tax the community mental health center service with not being able to provide or to be able to sustain providing that service. So we're very laser focused on that. I think more to come on that, but just to say that the department is spending a lot of time and meeting with folks and meeting with Behavioral Health Association and be talking about just about exactly that.
Thank you so much.
And Commissioner, you mentioned the word unwind. Do you want to tell people what that refers to? I'm not sure everyone knows.
I know, right? The lingo and all of those things. So unwind really is the term for going back, and when we had COVID, there was no the eligibility requirements were not what they typically are, so that there was a higher threshold for who could qualify for Medicaid. Once COVID was over, it was okay, states, you need to go back to your regular eligibility process. So what the state of New Hampshire did is we got a jump start. We actually started before a lot of other states. We started a year before a lot of other states did, to be able to slowly and methodically be able to go through and make sure that folks were able to become eligible again if they were not going to be deemed eligible. Sometimes this has to do with people not being aware, us not being able to reach people. So there was a large outreach effort to be able to say, make sure that you fill out your paperwork, because we didn't want to just have people off of Medicaid because they didn't fill out their paperwork. So we've done a tremendous outreach effort. We have a call center. We are back to our levels of what we were pre-COVID pretty much for our Medicaid enrollment. But what we do is for the folks that necessarily may not be qualifying for Medicaid, of doing that warm handhold to what kind of insurance can they be eligible for. And or we have folks that we took our most complex residents and did them last. So I think, you know, the folks that we have left to look at are very few and far between, but we haven't really made this effort to say like, oh, you're just off. If somebody hasn't done their paperwork, we're reaching out and making sure. So that unwind is the national term that's used for it, but it's really looking at who you have on eligibility, who you have on your Medicaid rolls, and are they eligible as we know it for the rules.
Thank you for that explanation.
Yes.
We have a couple more questions coming in. So are we working with public schools to develop awareness of programs and resources and developing emotional intelligence and awareness within the curriculum?
You know, it's interesting because I'm not responsible for the DOE side of what gets said in curriculum, but what we can do and what we are doing as a department, and I don't want to talk jargon, but jargony is that we are making sure that schools have the resources and are able to bill Medicaid for supports that they are giving for behavioral health in schools. That's super important because we know that that's where the bulk of kids are spending their time. We are able to work with schools and talk with schools, but we don't have any authority over their curriculum. So yes, we will influence that and speak about that, but I don't have any authority to do that. But what I do have the authority to do is to make sure that schools have the capacity to continue to add and build to their behavioral health resources within the schools. And we're actually applying for an additional grant to get some more money to be able to do that. We're in the process of applying right now.
That's great. Thank you. Next, as a parent of an adult son, I'm trying to look to his future. How do I know if our son will have to pay back his Medicaid benefits if he inherits some money at the time of my death? I don't know if that's something you can answer.
I mean, it's definitely, I understand the question. I don't know if I can specifically say, you know, give you a technical answer. I think what I would say is whoever does have that question to please reach out to us at the department. If you want to call our Medicaid director or you want to call me or reach me offline, we could probably work with you through that question a little bit more detailed.
And folks could also contact our information and resource line as well for help with navigating some systems. I'm not to say that your department wouldn't have all the answers, but I just want to add that is a resource for folks as well. So.
And I'll put a plug in that they will actually be staffing a booth during lunchtime in our exhibit area. So a good time to go visit with them and talk with them live.
And whoever put that question in, it looks like one of our staff is thinking that would actually be a really good topic for a future webinar here at NAMI New Hampshire. So thanks for the idea as well.
Yes.
And an important issue that I know many of us, parents of children with serious mental health challenges, as well as other types of disabilities, we have to be very conscious of as we age and life takes its natural course. So it's a great topic for us to do more with. And Commissioner, I wondered if you might want to speak a little bit to, you know, we've seen a lot in the media about Hampstead Hospital and struggles there. Actually, with one media source, I'll be clear. We've seen one. And can you speak a little bit to, you know, the staff there? I know that they're very dedicated and committed, and I know a lot of folks have really benefited, or their children have benefited from the services at Hampstead Hospital, both recently and through the years. It has been a valuable resource in our state. So I wonder if you want to give us a little oversight, a little overview of how folks are doing at Hampstead Hospital, and particularly the staff who we know are really doing such great work.
Yeah, no, it's a great question, and I appreciate your observation in terms of media.
I will say this, I will start by saying is that I want to affirm everybody that the facility is safe. It is a facility that is safe and is providing good care. And it's providing good care because, Susan, as what you just said, we have some really tremendous staff there. We have a dedicated team that are providing round-the-clock care to some of our most complex youth that we have. It's not an easy job. And there are times when it gets super intense. And, you know, part of our job as the state is to be able to make sure to support our staff, make sure that staff residents are safe and that staff are safe. And that's what we're laser focused on. But I will tell you, we have 37 kiddos in there today. And I know that they're all receiving the care that they should be. And we did have a little bit of a, I think, a delay in some of our admissions while some of the stuff was happening last week, but that has since dropped with the wait list. And like I said, we're up to 37, but got some really great people there. And I don't want that to get lost in the sight of what's been going on. It's a psychiatric hospital. It's the highest level of acute care that you can get. It's a challenging service, but we are safe and it is a good service.
Well, thank you, Commissioner. And for folks who haven't ever been there, it is also a beautiful facility. I mean, it's lovely. And I'm thinking another to-do list for the team might be working with your team at Hampstead for maybe a virtual tour that we could have on our website, so folks have a chance to sort of see it, because I think I think you wouldn't understand if you have not been there, and I realize not everyone can tour a facility, so it'd be nice if we could offer that for families to see it.
Sure. Yes, we have a new CEO, Justin Lucier, who comes to us from Portsmouth Hospital. So I think he would be more than happy to be able to arrange for that to happen.
Great. We'll look forward to it. We got some more questions, Michelle?
Oh, well, actually, I just copied the response into the chat from Nancy Fennell. She put in about the resources at the Foundation for Healthy Communities around access to care for Medicaid. So I just shared that in the chat.
Did we have a question about training for staff? CMHC? No, did I miss that? Okay.
I think it's on workforce, building workforce.
Yeah, I thought there was a workforce question, yes, but now I don't see
How
it.
did I miss it?
I think it says I have it, besides providing additional training, what efforts are being made to build the workforce to meet these goals?
Okay.
Am I the only one that sees that question?
I saw it. Oh, maybe it's in the
It's
chat.
in chat.
That's it. I knew I saw it pop up. That's why.
Thanks, Karen.
We'll find it.
So I would say that this is probably another webinar. You know, I have one of my staff is working. I tasked her with going forth and finding out all of the workforce development initiatives that are happening throughout the state, and seeing how. And I will tell you that there is a plethora of them. So there's a lot of good work happening. My concern is that it's not connected or integrated to be able to become internal, systematized. So there's a lot of work out there right now. I'll give you some examples in terms of workforce, like even with staffing at New Hampshire Hospital for nurses. That's been one of the primary reasons it's been hard to open up some of these units. One of the reasons we had to renovate, which is the other reason, but really working with schools where we are having an agreement where they I forget the technical term for it, but they basically get their schooling, and as they're getting their schooling, they're actually doing some real-time work, and then they're working with us after that. There are workforce bills happening in the legislature right now to be able to make some changes and create some capacity. So there's a lot happening. My concern is that it's not going to be integrated or concerted enough to make a difference. So that's what we're trying to do as a department, to bring attention to that so that we can hang on to some of these gains. So I know that we work with a lot of our folks who come through our work employment programs as well, and making sure to divert them and offer them and make them aware of the opportunities that we have currently as well, whether not just with the department, but I would say behavioral health in all areas across the state. So there's quite a bit going on. And I think at some point it'd be great to have it all sort of put forth together so that we can see what those pieces are. And that the other knows what the other's doing, which is probably my concern. Susan, I don't know if you have anything to add on your end on that.
One of the things that always comes to mind for me, Commissioner, is our peer workforce. And I know there's work afoot to really strengthen that peer support workforce. I don't know if you want to speak to that at all, in terms of the certification process underway.
Yeah, I don't. Yeah, I think I did mention that in my slides. I think we have about 24 that are about to go through that right now. I don't have the rest of that with me, but I think coming from all angles, everything that we're trying to do to be able to increase that capacity and provide opportunity and provide that certification.
And there are a number of efforts underway in this legislative session around workforce development, which NAMI New Hampshire is indeed weighing in on and working with a broad coalition of partners around these workforce bills. So that is ongoing work. I think we all know that we have to continue to encourage people to enter the field and provide ways to make it financially feasible, such as student loan repayment programs. But also we need to be creative in terms of, maximizing the resources we have, looking at things like being able to join interstate compacts so we can have providers come in from other states, as well as, looking at opportunities like further developing our peers and also utilizing bachelor's prepared folks more. New Hampshire has not always, in our mental health system, not always really use bachelor's prepared folks the way we hear about in some of our sister states. So I think we'd be more creative too.
For sure, for sure. We did have the reciprocity. I think recently we did have some releasing of some of those restrictions as well, which opens up in terms of that interstate that you're talking about.
Yes, and if folks aren't aware, there is one left to do, and that is the Social Workers Interstate Compact, which is currently active in this session. So stay tuned. If you're not signed up for our public policy alerts, go to our website, sign up, and you'll hear every Friday about who you should contact and urge to, vote a particular way on legislation. So
We have a couple more questions. I know you have a hard stop soon, Commissioner. Can you speak to your thoughts on incorporating the voices of lived experience at DHHS?
Well, as Susan mentioned, I mean, pardon me if I wasn't clear enough, and a lot of our work with Mission Zero is trying to include folks with lived experience as well. I think that's something that, we have a couple of bigger initiatives right now that we're also looking at. How do we do that? So whatever the topic is for DHHS is that the end consumer of the service is a part of working on that design and those improvements. So that is sort of a model that we're trying to emulate throughout the entire department. I think it's obviously probably most obvious in some of our behavioral health work, but that is one of the values, I guess I would say, that is important to us as a department and the work that we do and the policies that we create and the programs that we have.
Great, thank you. And this is more of a statement about children. Children are the future workforce. Working with public schools is key to destigmatize mental health and see it as something that affects everyone indirectly, if not directly. And we all believe that, know that completely. So that was the last one we have in the Q&A.
And if I could tag on to what you were talking about with that voice of lived experience, Commissioner, I am so conscious, particularly as we've sort of seen, this interplay between the 10-year mental health plan and the Mission Zero initiative. I think back, we're in year 11 of emergency department boarding here in our state and truly seeing some real progress at this time. But I want to give full kudos to the countless folks who have in so many very public forums shared their deeply personal stories that are often very painful around emergency department boarding to motivate our policymakers in the legislature to fully fund what we need to address this issue, and as well as informing that 10-year mental health plan and ultimately Mission Zero. So kudos to all of the advocates and those who maybe didn't anticipate they were going to become advocates, but were compelled to share their stories. So thank you. Truly.
We can't make the change without that voice, for sure. I think, it's hard sitting in this position where, we're working in challenging systems and bureaucratic systems, and you just want to make the change. You just want to make it happen, right? And you hear the pain and you want to be able to respond. So, the key to that is all of our systems working together, and even that it's super challenging. But if we don't have that voice, it's not going to happen. We need that, so it's critical.
So, Commissioner, as we look towards the coming year, anything that we should be keeping our eyes on in particular?
Well, there's one of the things I talked a little bit, I think, last year is I dubbed this thing called the roadmap, which is really a strategic focus and disguise of the word roadmap. And we used that a lot last year to include a lot of the things we've been talking about here today, but use that as our talking points with our legislature, with our stakeholders. These are the things that we're hearing are important to our constituents. We need these things. We are working on formalizing, now that I've been named full-time commissioner and have a term of 4 years, we're really looking out. What can we be doing in those 4 years? You know, when you sit in this driver's seat here, it's like, okay, you got 4 years. And so 4 years is a lot of time, but it's really not a lot of time. So what can we be, how can we keep the momentum and then even accelerate some? So for all of the populations that we serve here in the department. So you'll be looking out, we're going to be reaching out to our stakeholders here coming up next month, the next couple of months, to be able to get some input and feedback on what we've laid out, including NAMI, obviously, is a major stakeholder, a lot of our providers, a lot of our families, for folks receiving services, as well as the legislature, because in this job, it's really hard for the department to do anything without the legislature's support. And we definitely want that, because we want to be able to make some systems change, lasting change, which is what we're aiming for. So in our new plan that's going to be coming out, or I would say beefed up or enhanced roadmap business plan that's coming out, you'll be able to see a lot more of what we're focusing on. It says, well, what is the department doing? These are the things that we're doing, and this is how we're doing it. And then being able to solicit feedback from all of you of where do we need to course correct? What do we need to continue to strengthen? What do we need to work on? So I think you're going to be seeing that coming out in probably May. You'll see that and working on that, and that'll give a little bit more detail. I can't really let the cat out of the bag too much before we release it, but it's coming.
Well, we'll keep an eye out for it, and we will certainly make sure that we get word out when it's available. So we look forward to seeing that roadmap. And want to thank you for your leadership and your willingness to step in, I think, during what I would think would have seemed a challenging time to take on the role. So we really look forward to our continued work with you and your team. And truthfully, if you need NAMI New Hampshire, the NAMI New Hampshire family to make some noise or hold some people's feet to the fire, always reach out. You know, we definitely want to help with moving these initiatives forward and making sure that New Hampshire has the most, is once again a leader in the nation in terms of its mental health system. So we look forward to our continued partnership with you on all these endeavors.
And I thank you, and I would say the same to you, to Susan and team, that we couldn't do this without you. So we've been through a lot of work this last year, some good work, and it's not been without pain, but we've made progress and we've moved the needle and we're able to get to a better spot. So I want to continue that, even though it's the most challenging work, if not now, when. I'm committed to doing this work. May not always be perfect, may not always be the right thing, but our values and I think our mission and vision are aligned, and I'm grateful for that. So thank you.
Thank you.
Thank you so much for your time this morning, Commissioner. I hope you can see the celebrations and the hearts and the applause that you're getting below. So thank you so much. And
those are lovely and very, very affirming. I would love to go through my whole day having little hearts and hands. I'll hold that image. So it's very good for the mind. So thank you. And I apologize for having you leave, but thank you and have a great conference.
Thank you so much.
Take care. So folks, we've got a little more time here. I thought I would share just a little bit of NAMI New Hampshire's perspective, and then we'll finish up with a few words from our HOPE sponsor at the end here. So really grateful the commissioner was able to fit us in before she had to get to governor and council meeting this morning. And indeed, we are seeing a lot of movement in our state. As I mentioned at the beginning, I am thinking about today, thought back to last year when I had this conversation with Commissioner Weaver and all of you. And Indeed, last year, on that day, we had 33 adults boarding and 16 children boarding in emergency departments. The commissioner mentioned today, she mentioned that there are 7 adults boarding. Those are 7 adults subject to an involuntary emergency admission petition. I do want to be clear, there are another 4 adults waiting in county corrections facilities and 3 folks who are not subject to an IEA, so that involuntary admission, but are also waiting for beds. So we are seeing significant changes in the numbers of adults boarding. And similarly, this year, we have 7 children boarding as of late yesterday afternoon. So it's really hard. It's a really hard process, this systems transformation, but I do believe we are seeing true movement forward. And with the additional beds that are coming online and additional transitional housing, I think we're going to see that adult number shift even further. So stay tuned as we will continue to report out those numbers on our social media. We do so every Tuesday and Thursday. So we will continue to do that and keep you apprised as these efforts move forward. You know, in terms of this year, where we are over last year, we certainly last year was one that we saw some real losses in our NAMI New Hampshire family. We have folks who lost loved ones, sudden unexpected losses to overdose deaths, suicides, and other unexpected losses, and then others that were known that they were coming, but it's still been a year that we have lost some of our own, and we know that there are many folks who experience such losses, and we try to be here and provide support for people as well as our own NAMI New Hampshire family. One of the things that we really looked at here at NAMI New Hampshire in the last year has been particularly, you know, we've always had folks, I don't think any of us who are family members certainly don't have an experience of someone in your life who maybe have a co-occurring mental health and substance use disorder. And NAMI New Hampshire has really started looking at how we can make sure we are best serving the needs of folks who come to us facing struggles with those co-occurring disorders in their families, and naming it, because I think while clearly always those folks have come and availed themselves for support and education services and come out and advocated with us, we know that this siloing between mental illness and substance use disorder is ultimately, in some cases, deadly for folks. And we need to make sure we break down those silos and ensure people can get the care, evidence-based, trauma-informed care they need when and where they need it. So we look forward to partnering with all of you as we continue that work. We continue to celebrate one of the silver linings that COVID left us with, which is a continued openness in talking about mental illness, substance use disorder, suicide in a way that we had not really seen prior to the pandemic. And again, I want to give a huge shout out for our youth and the young adults amongst us. They are absolutely leading the way in terms of making sure that these issues don't go back into the shadows. Our Connect youth leaders continue to inspire me, as do our Connect young adult leaders and our folks who are volunteering with our Ending the Silent Speakers program in the school system. Our young people give me so much hope. And so if we all could manage to not screw things up for the next 10 years, I have great faith in our future. Because we have wonderful young leaders who are ready and ready to be part of the solution. So we'll continue to work with our youth and young adult leaders and expand those programs. We're very happy to be able to, thanks to NAMI National, we have one scholarship for a youth leader to attend the annual NAMI convention. And we'll be joining a small group of folks, volunteers and some staff here from NAMI New Hampshire who'll be attending there in June as well. I want to give a huge shout out to our volunteers. I'm 200 strong across the state. You have sustained our core programs, our signature programs, from family to family to peer to peer, NAMI Basics. You know, I want to our support groups. You are so critically important. Our advocacy work, frankly, we could not do this without you. We have been overwhelmed with the number of new folks wanting to come and volunteer here at NAMI New Hampshire. So really see this as a place as mental health, substance use disorder, suicide. Those are all issues that clearly are very important to people. And we welcome you to the NAMI New Hampshire family and look forward to our work together. Do want to mention that we have a few new things, particularly on our website. We've got some new web pages with resources for maternal mental health, older adults, substance use disorder, and co-occurring disorders, and eating disorders is our newest web page. So please check that out. We are always trying to keep our resources up to date. You will notice it when you're on our website. It is a large amount of information. Feel free to shoot us an email if you think there's something missing or something needs to be updated. We do try and monitor it, but we're always welcome to input. We also just in this year launched our new online training platform, and stay tuned as we will soon have our online Connect Prevention program available in Spanish on there as well. And then in terms of our DEI efforts, we have done a soft launch for our information resource line, responding to Spanish speaking callers. So bear with us, but we have done it. So we continue to work in making sure that we can be as accessible as possible. Diversity, equity, inclusion is baked into our strategic plan and continues to be very important here at NAMI New Hampshire as we do program planning. Indeed, we offer quarterly DEI trainings, and we have just started expanding that beyond our NAMI New Hampshire staff and volunteers. So you'll have some opportunities to join us in some of those trainings in the coming year. And I just want to encourage you to, again, sign up if you're not getting our e-news or public policy alerts. There are 2 separate email lists. Please sign up for it. There's a lot going on at the legislature this session. We had last year some really great successes, including those Medicaid rate increases that the commissioner mentioned. The budget was historic in terms of mental health and healthcare. It included a 7-year reauthorization of Medicaid expansion, expanded Medicaid coverage for new moms postpartum up to 12 months, which we know is so critical in addressing issues around maternal mental health and ensuring better outcomes for our babies. And then additional investments in workforce and all of the components of the Mission Zero initiative. And frankly, that happened because of grassroots advocates. In the final hours, we were asked to have our advocates reach out and to House leadership and ask them to concur on the Senate's budget, which we put out the call and you all responded. And shortly thereafter, we heard from House leadership who said, we got the message, can you get them to stop? And we waited for them to concur on the budget, and they did, which was the first time. No one is able to remember another time that they have done so, and it did not go to a committee of conference, and the entire budget with those investments remained intact and was signed into law. So hats off to all of you who made those calls and held folks' feet to the fire, so to speak, to get that done. This year, we've got more work around workforce development, also looking at a bill to create a study commission to look at competency, which is really important here in our state because we really are lacking in services around competency and restoration. And we do have a new forensic hospital that will be coming online at the probably very beginning of 2026. And so there will need to be some changes in our current statute to make sure that that hospital can be fully efficient and function properly. So we are hopeful that study committee will get approved and get its work done quickly. And another area that we continue to really focus on, folks who are justice involved, as well as suicide prevention. And that includes things like access to lethal means and making sure that people are able to access critical crisis services. And then there are a number of bills that we are really concerned about how they could have a very negative impact on the mental health of our youth, particularly our LGBTQ youth. And we are working actively with partners across the state around those. So again, encourage you to join us in these advocacy efforts. It's a very busy session and we welcome you. Our Public Policy Committee is open. You can reach out to us and we'll be happy to add you to that. And again, sign up for those alerts. I will tell you that NAMI New Hampshire is in the midst of a strategic planning process, and we have had wonderful input from our NAMI New Hampshire volunteer leaders, our staff, as well as many of our partners and stakeholders in the community. And we look forward to unveiling that at our annual meeting in June. I do want to mention before I turn the floor over to my good friend Ward here that save the dates for This Is My Brave. NAMI New Hampshire is hosting on May 15th, and our annual NAMI Walks New Hampshire, the state's largest mental health and suicide awareness raising event, comes back on October 6th. So please mark those dates and join us. I'm thrilled to be able to introduce our friend Ward Bennett, who he's been with Johnson & Johnson for 27 years. However, I want to mention, it seems like he's been with NAMI New Hampshire for just as long. Ward has become a really integral part of the NAMI New Hampshire family. He, in addition to being at Johnson & Johnson for 27 years, he's been in the medical field for a total of 32 years. And as the Healthcare Policy and Advocacy Director for the past 20 years, he has worked with multiple medical disciplines on patient access to the healthcare system. In addition, Ward has volunteered with NAMI New Hampshire, and he is a trained inner own voice speaker. He has taken peer-to-peer. He is also a member of the Northern New England Arthritis Foundation volunteer board. He is a Connect group participant, and he has been a very long-standing member of our own Public Policy Committee. Ward lives in Amherst with his wife, Peg, and we are really grateful to have you here. Thank you and Johnson & Johnson for your support for this event.
You bet, Susan. Yeah, it's been a very, very great relationship with NAMI New Hampshire for the last number of years. And this conference is so inspiring so far with Dr. Amador and with Lori Weaver. It's really incredible. So I'm just sitting here thinking like everything that I was going to talk about has already been touched upon in multiple ways. And it's really neat to see because, as Susan said, a lot of you may not know me, but I have been, as Susan said, I've been very engaged with NAMI New Hampshire for over a decade. And I've seen my job is healthcare policy and advocacy. So I'm not sales. I'm just working to try to connect different advocates in different areas, different disease states to really move the ball forward in everything that has occurred. And as you see, like the Mission Zero, the amount of people who are waiting for ER beds right now, all of that. I mean, 10 years ago, 12 years ago when I came on the scene here in mental health in New Hampshire, it was kind of dire. Like the ER boarding situation was tough. And I was at the press conference when NAMI New Hampshire, called that out, and I was, the 10-year plan, kind of looking at it all along, and it's like, is this going to go anywhere? And it's amazing to see where it's gone. And it would not have happened without the constant kind of NAMI New Hampshire, kind of beating the drum and continuing to bring in everybody that they possibly can to engage and really advocate around, look, this is what needs to happen. We can't continue on this way. And it's just really satisfying to see all these changes really coming forward and people, getting the help they need and families being able to, get the help they need and all those. So it's just, as I said, it's very satisfying. But it's also like I've got, as Susan said, I've been engaged with a lot of the programs in NAMI New Hampshire and arthritis, and if I can just deviate to my little personal story here for a second, like I basically I've had mental health issues and physical issues like arthritis, rheumatoid arthritis, and a number of things that should have really been diagnosed in grade school in school times, and didn't get diagnosed till I was about 55. And here I am, walking in and out of some of the biggest institutions in the world, like Mass Generals of the world and all that, and just helping a lot of other people hopefully get what they need through the advocacy that I'm doing. But I was not there. So, 55, you get this. And then when you do get those diagnoses, like you've got to kind of forge your own path forward because there's not really any place you can go that's going to take it forward. So, I think everybody's the own best advocate for for themselves in working in that. And that's what I've really tried to do with my work with, with the arthritis foundations and those sorts of areas, to really bring it forward. So I think that in this state, there are some great groups such as NAMI New Hampshire, like New Futures, the Arthritis Foundation, American Cancer Society, are located right in Concord. And it's really fantastic that they're right there. And the patient engagement, I think Susan said it and Lori said it, and a lot of people have said it, like the engagement with the legislators, with the process of getting new legislation passed and bettering our system is really, it can come down to one person's story. It can come down to, Susan said, one of my favorite stories, and I tell it all the time. The advocacy is like when on the budget, when they said, please make them stop calling. I mean, that is just advocacy at its core, and that doesn't happen unless that has been a focused piece of focus from NAMI New Hampshire and other groups within this. So I think that's really at the core of what I wanted to say. And just once you really get into, okay, this is what I'm dealing with, then not only do you need to kind of advocate through the system to get the healthcare you need, you also need to advocate for yourself to within your own world to say, okay, how am I going to make the self better when I'm not in a medical facility, those sorts of areas. So that's what you kind of live myself and work within that. And it's just been a great partnership. So I appreciate you. I appreciate the engagement across the board here. And thank you very much for having me at your conference. And we're proud, Johnson & Johnson is proud to support NAMI, now and in the future. So thank you very much.
Thank you, Ward.
Thank you, Ward. We do always appreciate your time and your generosity, as well as Johnson & Johnson and your advocacy efforts. I also want to thank Susan for all your time, and I'm clicking on the wrong button, for all your time last night and this morning, and we will see you again. So just real quickly, I want to thank all of you for joining us this morning. Be sure to check out our virtual expo center. Some of the booths, including NAMI New Hampshire's information and resource, which we've talked about today, and volunteer booth will be staffed during our lunch break from 12 to 1. So make sure you stop by and see them, as well as all of our booths that are open. Please keep an eye out for the evaluation that'll be mailed out to you at the end of this conference. We appreciate your feedback on this session and the conference as a whole. If you need a certificate, you will be able to download one after completing the survey. A recording of this session, as well as all of the sessions, will be available later this week in the lobby and up on the NAMI New Hampshire YouTube channel. So coming up next at 10:15, we're very excited to have Professor Giulio Del Sesto presenting an Everyday's Hero Journey from Struggling Student to Successful Professor. We hope to see you there. It's really talking about our everyday heroes, and he's fun, even though he doesn't feel like it. So thank you all for joining us this morning, and we'll see you at a session later today.